We start in Myanmar. COVID cases peaked last month, but the country is hardly out in the clear, with 4,000 cases reported daily and a total of more than 340,000 cases and over 12,000 deaths. It's been tough. The pandemic is not only stretching medics to the limit, but also those who have the grim job of collecting bodies. Here's a look at one team at work in Yangon.
Bo Sen is on another call-out. His team races through Yangon in their ambulance, not to save lives, but to collect those who've lost the fight against COVID-19. It's the tragedy behind the statistics, and these volunteers are struggling to keep pace. The corpses are lined up day and night. Some people have to keep the bodies in their homes for days until they can find a hearse to take them away. So the bodies start to rot and smell really bad. As the pandemic worsened in Yangon, residents began flying yellow flags in a plea for medical help. But too often, help didn't arrive, only now to collect the dead. Outside the crematoriums, the backlog of bodies is on display. Rows of makeshift coffins fill the pavement, while long lines of hearses wait to bring even more. The dead bodies are piling up. Some even take a day or two to get cremated. There are simply too many for the number of vehicles. As another of those vehicles unloads, Buddhist monks offer prayers on the curbside. Myanmar's COVID emergency is adding more pain to a country already deep in turmoil.
Public health services are clearly collapsing in Myanmar. The UN estimates that only 40% of Myanmar's healthcare facilities are still functioning. People on the ground say the situation is actually much worse. One critical need the country's short of? Oxygen.
It's just after dawn in Yangon, Myanmar's largest city. In front of this mosque, the line for oxygen refills slowly shuffles forward. People have already been waiting for hours, desperate for medical oxygen for loved ones with COVID-19. If we want to get oxygen, we have to come here early. Even though I came here at around 4 in the morning, I had to stand back in the line, as some people had already arrived. For many in Myanmar, treating COVID-19 is a do-it-yourself project. Oxygen and hospital beds are scarce. The mosque decided to offer oxygen as a way to help. Initially, we thought of distributing meals to COVID quarantine centers, like we did last year. But we changed our decision as we saw people in desperate need of medical oxygen. It's available here, free of charge. Religion, ethnic background doesn't matter. All who wait are served. It's a lifeline, as most people here can't afford to pay. Prices have more than tripled with the infection surge. The military government has not been able to effectively manage the health crisis. Authorities are now even forcing oxygen factories to close. So we're struggling to get enough supplies to refill the oxygen tanks. At public hospitals, there aren't enough medical facilities, and they're finding it hard to cope with the demand for oxygen and other essential drugs and equipment. With the country in crisis, these Muslim volunteers say they want to join with the Buddhist majority in the fight against COVID-19. We're worried because we're Muslim and a minority here. Frankly speaking, we're concerned about the potential threats against us. We just want to fill in the gap and help people. And many in need are taking up the offer, as they have nowhere else to turn.
Joining us is journalist Myint, who follows events in Myanmar. Both reports we saw just now show volunteers stepping in because there's a shortage of medical professionals. Is that the case across the board in the country?
Yes, so even before the coup, volunteers were a key component of the COVID-19 response, except what we're seeing now, post the coup, with the junta's takeover of state-run hospitals as well as the arrest of medical workers, is that volunteers are now not coordinating centrally through the state, but are rather working really neighborhood by neighborhood and working in a very piecemeal way, which means that, not only are they kind of wasting human resources, we're seeing redundancies, we're seeing people kind of not being as coordinated as they could be, but also people are kind of just operating in the dark, not really knowing and in where resources are coming from, and in some cases competing with one another for resources.
I mean, you talk about the arrest of medical workers. This health crisis can't be divorced from the political situation going on in the country. Can you tell us a little bit more about that?
Yeah, so the civil disobedience movement is a key component of the resistance against the coup in Myanmar, and that is really led in part by medical workers and doctors who are already seen as sort of leaders in Myanmar society, really led the charge in this non-cooperation campaign against the junta. And so now we have state-run hospitals that are deeply understaffed, and doctors who are on strike are also not practicing medicine because they're afraid that if they go to a clinic, if they start some sort of community clinic, that they will be arrested. And on top of all of that, the junta has also arrested, in the early days of the coup, the head of the COVID response.
That seems really counterintuitive when there's a crisis for the military to be going after medical workers. What's the decision-making and thinking behind that?
So in many ways, the junta cares a lot more about control than the preservation of life in the country. We saw this in the past where in 2008, Cyclone Nargis tore through the country and killed over 140,000 people. And the junta really refused to allow aid into the country if it wasn't allowed to be channeled through them. And in recent days, we've also seen that the junta has forced oxygen supply companies to only provide oxygen to state-run hospitals and to prioritize junta allies as opposed to providing to the public as, demand demands. And so we're really seeing a way in which the junta is trying to use COVID as a way to solidify its control at the grassroots level.
And how do you think the military's decisions here will play out in terms of their ability to maintain control over the country? I mean, their decisions are literally killing people. That's what you're telling me. That's what we're reading about.
Yeah, I think in terms of the decision-making, it's not something that is very surprising from the junta, especially given the military's decisions through past military governments, but also its actions during civilian rule in the last 10 years. But I think what we're also seeing from the civilian side is a sort of determination to see the revolution through, regardless of what the outcome is. So, in the early days of the coup, we're 6 months in, some people have essentially willingly foregone salaries for 6 months in a country that is quite impoverished to begin with. And so you have these two sides kind of battling it out, and the lives of everyday people are kind of hanging in the balance.
Myint, thank you so much.